Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey. It's Medical Monday at East Cooper Medical Center, and today we're sitting down with a colorectal surgeon to learn what the signs, symptoms, and treatment options are for those suffering from diverticulitis.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Susan Kanaka. She's a colorectal surgeon here at East Cooper Medical Center. Thanks for being with us today.
Thank you for having me.
All right, today, I hope I don't butcher this, but we're talking about diverticulitis, right?
That's right.
All right, what is that?
So I'll back up and say diverticula are weak spots in your large intestine or your colon. And these weak spots are there your whole life, but they develop into true diverticular or outpouchings generally after the age of 40, and then it progresses as you get older. Not everyone gets them, but some people develop diverticula, and then when they get infected or inflamed is when we call it diverticulitis.
Okay, so is this like a chronic thing? I mean, is it something you'll experience for the rest of your life? Do you take some medicine and it goes away?
So the presence of the little weak spots in the colon are completely asymptomatic. Okay. Patients don't ever feel anything, and the majority of patients will never have a problem with it. Okay. Your GI doctor might do a colonoscopy, see it, and tell you, oh, you have some diverticula there, or if you ever got a CT scan, the doctor may say, oh, by the way, you have some diverticula, but it doesn't matter. Okay. It's only for those patients that develop an infection in the little outpouching, in that little weak spot, that they'll develop abdominal pain, maybe changes in their bowel habits, maybe a fever, that prompts them to go see the doctor.
Okay, so does it kind of mimic something else that maybe they might let it go on?
Yeah, that's right.
Like
people
a
might.
Stomach bug or
that's
something?
Exactly right. People often think, oh, I ate this restaurant and now I have abdominal pain. I must have gastroenteritis, and it turns out that they're having episodes of diverticulitis.
Okay, and so how do you treat that?
So mild forms can be treated with some bowel rest, so usually eating kind of a lighter diet or drinking liquids, and then your primary care physician will generally give you an oral antibiotic. Okay. And you're on the antibiotic for maybe 5 or 7 days. The pain goes away, your bowel habits return to normal, and you're fine.
Okay, so this isn't like a Crohn's disease. I mean, it's not in that area.
Generally, is not an inflammatory bowel disease. That's a whole different type of problem. This diverticulitis happens throughout the population. Okay. There's no kind of genetic component to it necessarily the way there is with inflammatory bowel disease.
Is there a particular time of the year that...
No, it's pretty much age-related and diet. We think it's diet-related. In non-Western countries where they eat lower amounts of animal fat and higher amounts of fiber.
And the obesity rate is lower?
Yes. The rates of diverticulitis is much lower. And if you take that same person or that same type of race and move them to the U.S. and have them eat a Western diet,
they get all jacked up, right?
The next generation will develop diverticulitis.
Oh, wow. All right, so as far as having good health when it comes to our colon and things like that, I mean, diet's a good thing, right? Yes. What are some of the other tips
There's other things that people don't necessarily think about affecting their gut. Smoking, so just like with all aspects of your health, smoking is bad for your colon.
Because you think it just affects the lungs, don't you?
No, but it hurts your colon and increases your risk of diverticulitis. Oh, wow. Obesity, like we talked about, a sedentary lifestyle. For some reason, movement promotes bowel movements, decreases sort of stagnation or stasis in the colon, and decreases the rate of diverticulitis. So it's actually better to exercise.
A body in motion stays in motion or something?
Yeah.
I've heard that before.
Yes, exactly. And then we talked about diet.
Diet. So that's kind of what you stress to your patients, especially ones that maybe will come in and are overweight and things like that.
Yeah, or already have diverticula and need to prevent diverticulitis, or who've had recurrent episodes of diverticulitis. They'll do better with a higher fiber diet, a lower animal fat diet.
Alrighty. Well, so if anyone's experiencing symptoms of just what again? I want to make sure that they know.
Abdominal pain, changes in their bowel habits, maybe a fever. They should see their primary care physician.
The fever is the one that sets it apart from other things, right?
That's right. or if it's just particularly out of the ordinary, or if it's recurring. And actually, the primary care physician in that scenario will sometimes refer to me because patients who are having recurrent episodes then might need to see a surgeon to have that segment of the colon removed.
Okay, so that's when you would come into the
And
picture.
remove that segment.
Alrighty, well, thanks again for being here. And for more information, head online to eastcoopermedctr.com.